Nobody on the planet knows this fact. Nobody sees this pattern, and nobody's teaching about it. Adrenals can be a target and is frequently a target of autoimmune disease.
I know it's mind blowing. And I think it's so important when you say we have the data to prove it. You will see an actual lab result today that Dr. Maggie, you're going to go over.
Yeah. And that's the thing is like I'm not a medical savant. I'm not here to woo woo. I'm not here to elevate with you. But I see patterns. I review tons of hormones every single week with participants together. We're learning together. And this is a pattern that repeats itself over and over again is that there are signs and data that clearly reveals a pattern of an autoimmune disease attacking hormone making organs, including the adrenals, that nobody is teaching because they don't know. Nobody on the planet knows this fact. Nobody sees this pattern and nobody's teaching about it.
It's so true because, as you mentioned, I'm in the program. And when I watch you go over somebody's results, you'll ask them leading questions
Yes.
about other
Mhm.
things regarding their health. And you're like, well, I bet you have X, Y, and Z. And without fail, they always say yes. It's like, how did you
Well,
know that?
first of all, you guys don't even get hormones tested. Second of all, even if your hormones were tested, you're told they're normal. And third of all, even if your hormones are tested and there's numbers around, people don't even realize, like, oh, that range on that hormone looks fine. Bullshit. What's the pattern of how these hormones relate to each? That's the missing link. That pattern actually says so much more than what the hormones are telling you. I can look at a set of results. I can already smell a rat. I already know exactly what's going on above that because there's patterns that are hidden in those results. Last week, we proved with data that adrenal fatigue is real, and I showed you data.
Yeah. And you showed us and you told us that there are 3 stages of adrenal fatigue, and you know exactly how to read each stage and decipher what's what based on the labs.
Mhm. And if there's phases of adrenal fatigue scientifically, and then on top of it, there's things that you can do to troubleshoot the cause of it. And then there's supplementation and lifestyle changes you can do that will cause a change in it when you retest and how you feel. That is indisputable scientific proof that it's real. It's also troubleshootable and it's also treatable. And there's retesting results.
For anybody who has not been in the program, let us know, how do you think adrenal fatigue is playing into your mystery symptoms and autoimmunity?
Last week, I did a really thorough training around, is adrenal fatigue real? Absolutely.
And
Mhm.
we got so many questions. Maggie, this was our number one most watched, number one most commented on. We continue to get comments about this even long after it was over.
Yeah.
So many people were thirsty for more.
People are just like, I have Hashimoto's, I have Sjogren's, I have, lichen sclerosis upside down. Like, what should I do? Like, like there was a lot of questions of how does it relate to an autoimmune disease? And I was like, it doesn't matter what autoimmune disease you have. Okay. 100% of people with autoimmune disease have adrenal fatigue. And there's a number of reasons for that. And everything that I teach in my hormone masterclass, everything that I teach in our main Transform Autoimmune program is designed to solve what's causing those hormone problems regardless of what autoimmune disease you have. And this is an interesting thing. We got Justine here, and Justine's saying, I asked my doctor to check my adrenals. Good luck if they know anything really about it. 100% regular doctors tell you, I'm not going to test it. You're fine. It's not even real. But let's say she did get a doctor to test it and do it the right way, like we do in my hormone masterclass. In our class, we do with saliva hormones. But I could tell you the story right now. She says she has fibromyalgia. She's a long haul and she's always
Mhm.
tired. She tested cortisol. Was it just cortisol, young lady? Oh my God. She tested cortisol and told me no problem with it. So that's just like really infuriating for me for Justine because you beg and beg and beg, and your doctor, and probably she drew her blood and did one cortisol. It's like your cortisol is fine.
That's
There's
what
so
I
many
was going to say. Was it just the one test? Because you've taught us you need to do it specific times throughout the day and be able to compare and see what could
pattern
happen.
people. It's about pattern recognition, not whether that number fits in that normal range right there at the lab right now, right?
Yeah.
I want to show you a typical pattern of somebody. In fact, Regina had these results this week. And I want to show you a typical result review. And I want to prove to you why, based on these results, adrenal fatigue can absolutely be an autoimmune disease. This is the DHEA and cortisol. Based on this, what pattern is this, Regina?
I am a low everything pattern, Dr. Maggie.
What the heck? Your doctors don't believe that exists. It's not real.
It is clear as day when you look at this result.
It's a pattern I call low everything. That pattern doesn't exist outside. Doctors don't know that. But low everything is a very unique pattern in autoimmune disease. Okay. I'm going to tell you this because Regina is 55, but she has hormones of a 90-year-old right now.
Doesn't
And
feel good.
and Regina, just this week, how many other people did you see with this pattern?
At least a half dozen just within my call. And then I watched the other day's call and I saw another half dozen. I mean, you're seeing so many of these people.
Because this is a pattern that's typically missed for people with autoimmune disease, and I'm gonna explain why. Pay attention, everybody, okay? So, there's no reason that a 55-year-old woman should have a hormone of a 90-year-old unless her organs are also a target of autoimmune disease attack.
Mm.
Mm. You will never hear this anywhere else. This is really critical, okay? What that means is there an autoimmune disease that can attack hormone-making organs, whether it's your ovaries, your adrenals, and your thyroid? I have a feeling. Did you have any problems with it based on your thyroid labs?
Yeah, I had low thyroid and I have a history as well of other thyroid problems.
So let's talk about that because the thing is, I can tell looking at this pattern, this person already likely has an autoimmune disease of their thyroid because they're low everything. Because I already know based on these results, it doesn't belong in a healthy 55-year-old woman. I can tell based on these results of low everything that she already has an autoimmune attack against these hormone making organs. So the likelihood she has an autoimmune attack against her thyroid is 100%, whether she knows it or not. But most of the time, the doctors don't understand thyroid either, don't know the right labs to do, and they don't even call it, they don't even test it. So, Regina, prior to this program, you're telling me you were already diagnosed with low thyroid before. Am I correct?
Yes.
Okay. So, here's the thing a lot of people with low thyroid don't even know they have autoimmune disease of the thyroid.
Yeah, because
So,
I tested negative on the antibody results.
she tested negative. She's lucky she even got a test, but she tested negative on her thyroid. So, she was told, you don't have autoimmune disease of the thyroid. Based on these results, I can already tell you the likelihood her thyroid is autoimmune is already close to like 90 to 100% because it's already attacking her ovaries and adrenals. So why wouldn't her low thyroid be an autoimmune attack of the thyroid?
Well, and that
Right?
makes sense because when you mentioned the ovaries, I have had trouble with my female system as well.
Yeah. Did you have any fertility issues?
I had infertility, yes. So perhaps this autoimmune attack has been going on for quite a while.
And this is why people say that the most common reason for infertility is actually autoimmune because there's an actual autoimmune attack against the ovaries, right? But that's the other thing is the people who have infertility issues, a lot of them also have adrenal hormone problems and also thyroid. So what people don't realize is that ovaries and adrenals can 100% be a target of autoimmune attack. In fact, I see it all the time.
And you can tell all of that just by looking at this page.
Even more. Think about this. I think even extrapolating more, I think your thyroid is autoimmune. So I'm going to ask you something. Do you have
Mhm.
any history of thyroid goiter, nodules, or cysts, Regina?
Both goiter and a couple nodules.
Did you ever know that the number one cause of goiter and nodules is an autoimmune disease of your thyroid?
My endocrinologist never mentioned that.
Boom. So she's been walking around with not just low thyroid, but autoimmune disease of the thyroid, with walking around giant Goomba with the goiter and a nodule. And people are saying, oh, your thyroid testing for autoimmune disease is negative. Therefore, you don't have autoimmune disease of the thyroid. That's crap.
When you start to realize it's all connected, that's when the lights really start going off above your head because
Mhm.
you have all of these symptoms and you've always been told that they're all separate things that need addressing or don't even need addressing. And yet you're able to tie it all together and then help us address all of it.
Absolutely. And so I'm going to just action item, massive action. Look, success leaves clues. Successful people take massive action. So I'm going to tell you when are you going to actually break the cycle of this in yourself, right? And so a couple things. Number one is that we have my hormone masterclass. If you want to get a start on just hormones, my hormone masterclass is there and which is focused on ovarian and adrenal hormones. And if that's where you want to start, that's great. We're going to have a link there for you to message our team and say, I want my hormone masterclass special. But the most important thing you can do is book a call with our team. So we'll put a link for you to schedule a call with our team to talk about it. And you can learn what that offer is.
You mentioned the 5 pillars, and it is the 5 pillars that's the true solution here. Once you implement
Yeah.
everything in the program, that can help stop the craziness of what's happening with your adrenals.
Mhm.
It can help correct things that are happening with your hormones.
Mhm.
All of the chips fall into place
Yeah.
once you achieve the 5 pillars.